This text is only for training your hearing. It is not a scientific article. Blood pressure. Part 1. Currently in Brazil there is a large number of people belonging to the third age group, many of whom are considered sedentary. On the other hand, it is also known that there is a high rate of people in this age group who have high blood pressure. Hypertension is one of the most frequent cardiovascular diseases in the elderly, has also been shown to have a relationship with physical activity. Although data on the elderly are limited, there is evidence that suggests that the elderly, who practice regular physical activity, have lower blood pressure values than a sedentary person. According to the authors, aerobic training programs have been able to reduce systolic blood pressure from 5 to 25 millimeters of mercury and diastolic from 3 to 15 millimeters of mercury. Despite the moderate effect on blood pressure reduction, this only occurs while aerobic exercise is being performed. It is important to note that the term hypertension is used medically for high blood pressure. It is worth mentioning that blood pressure is subdivided into two groups, systolic and diastolic. The first is defined in adults as blood pressure above 140 millimeters of mercury, and the second is above 90 millimeters of mercury. Blood pressure is considered normal when its values are equal to or below 120/80 millimeters of mercury. One of the problems of blood pressure being above normal levels is that there are no identifiable causes for most cases of the disease. Which exist are indications or risk factors such as genetics, excessive salt use, overweight and, especially, physical inactivity. Usually, high blood pressure is considered to be a person who may have some kidney problem, in the coronary heart or vessels that supply the brain. When the tests performed fail to find the cause of this problem, it is called essential arterial hypertension, and its cause may be psychosomatic. The lack of physical exercise can contribute to the change in pressure and that it may also become a serious case, putting people's health at risk. On the other hand, regular exercise can reduce blood pressure and produce additional benefits such as decreased body weight, total cholesterol, and excessive stress, among many other benefits. In view of the above, the present study aimed to design and develop a guided and controlled walking program over a period of 2 months, carried out 3 times a week, with a group of 10 sedentary elderly people, outlining their profile in terms of age, sex, heart rate, and blood pressure, analyzing the data collected to guide future actions that will provide a practice of physical activities that brings benefits to its practitioners with less risk to their health. To compare the results obtained, we also had a group of 8 people, belonging to the elderly, sedentary, and with changes in blood pressure levels who did not do any physical activity during this period.